One of the founding pillars of our company has been what we call the 3 C's. That is for caring, community, and convenience. We've established a dominant profile in the community, which now employing over 500 people. These are your friends, these are your neighbors, these are people that you see, and that is our workforce. The people actually live in the communities and work in the community. So they're very familiar with how things are done, who they're dealing with, and we've had patients with us well over 15 years that still come and get the same quality of care that they've gotten since day one. Convenience is another founding principle. We realized early on that the easier it is for the patients, the easier it is for us. The patients not having to travel long distances to see their healthcare provider, I think, is paramount to them being happy. So we've developed multiple locations and our footprint is always expanding to make sure that our patients are able to access care, keep them within their communities, and keep them close to their work or their businesses. And that's something that we really plan on moving forward with in the future to add even more locations. The providers at East Valley Family Medical are some of the best providers in the Valley as far as healthcare is concerned. They have excellent training. Many of them have come from their own private practices and merged into our organization. So they're very well versed in what needs to happen as far as the patient's care is concerned. They're always on the cutting edge as far as training goes, going to conferences, being educated, maintaining all of the CMS guidelines with quality and the criteria of their licensure. So I think it's imperative to say that the patients are getting the very best health care that we can offer them. One of the reasons many providers join our practice is because they're allowed the ability to see the patient and focus on the patient without worrying about all of the financial aspects of having a practice, or maybe the staffing issues that typically occur in a practice. Letting the doctors focus on being doctors and dealing directly with the patient is the most critical factor of our success. One of the things I'm often asked about is how do we select our providers to work with us? And the truth is, in the beginning, it was us recruiting providers based on need. However, because of our large and rapid growth, the expansion has shifted to providers now contacting us. We're very selective in the providers that we allow to join our practice. We only want the best providers that we can find, and we want the providers that are going to allow our patients to have the best possible outcomes. We welcome the opportunity to work with other providers in our community, and we're always looking to add to the ranks providers that care about the patients, that share our vision, and that are looking for a simpler approach to healthcare.